CheckMate 648 is a large global phase 3 randomized controlled trial in first-line treatment for advanced esophageal squamous cell cancer of the esophagus. It is the largest study that was being conducted in this disease, and patients were randomly allocated to chemotherapy alone, chemotherapy plus Nivolumab, and Nivolumab plus Ipilimumab. And in this study, 970 patients were randomized, and the primary survival data was in fact published recently in New England Journal of Medicine 2 months ago, where we shown that the addition of Nivolumab to chemotherapy or Nivolumab plus Ipilimumab both significantly improve overall survival compared to chemotherapy alone, both in the primary patient population with a PD-L1 tumor cell expression of 1% or more, as well as in all randomized patient population. So in ASCO this year, we have reported some of the extended analysis from this large randomized controlled trial. Because the first thing that often clinicians will ask is that and in fact, based on this data, because these regimens are now licensed in different countries. So in Europe, in Japan, and most recently in US, about 10 days ago, they were all randomized. But they're all licensed. But the license is different between different countries. So for example, in Europe, this treatment is only licensed in patients where they have a tumor PD-L1 expression of 1% or more. Whereas in US, they actually are licensed in all comers. So the next question clinicians often ask is, how do we actually choose patients? Do we only choose patients who have a high PD-L1 expression of 1% or more? Or can we treat everyone? So the extended analysis that we have presented also look at another scoring criteria, which is very familiar to upper GI clinicians, oncologists, which is using the PD-L1 combined positive score, or CPS. So let's look at PD-L1 in both tumor as well as immune cells. And what we're able to demonstrate is that, in fact, the survival advantage, for example, for Nivo chemo versus chemo, was seen in those who have PD-L1 CPS 1 or more. Then actually that is over 90%, or in fact 92% of the patient population. So that is why we see the all randomized patients were getting the survival benefits. And that is also the same in the comparison between Ipilimumab, Nivolumab versus chemotherapy. Now, other analysis that we've done, which again supports this regimen as the new first-line option in advanced esophageal cancer, is that we look at what we call PFS2. So these are looking at the time when patients progress through their first line, but also through their second-line therapy. And what we observe is when patient receive IO, so either in the Nivolumab plus chemotherapy arm or the Nivolumab plus Ipilimumab arm, they actually have a more prolonged PFS2 compared to those who have chemo. So it appears that as long as they have some pre-exposure to some checkpoint inhibitors, they even benefit them in the subsequent line of therapy. And I think that probably explains why we're seeing the overall survival benefit we observe in CheckMate 648. Lastly, which I think is of quite important, again, just showing really the efficacy of this new regimen, is that if you have a response which is achieved by having the addition or having checkpoint inhibitors, Nivolumab, your response is going to be much more prolonged than the response you achieve with chemotherapy alone. So what we are able to see is the patient who responses were beyond a year. So they actually very durable response over a year. You have a much higher proportion in the Nivo plus chemo arm, as well as the Nivo plus Ipi arm compared to chemotherapy. So really, I think the data that we present at ASCO this year, we reinforce these two regimens as the two new standard of care in first-line therapy for advanced esophageal squamous cell cancer.